Hi everyone, my name's Lisa St. Marie, and I'm going to be teaching you tonight about fetal monitoring, which is probably going to be a review to y'all, because I'm sure you've also done some studying on it already. But we'll go ahead and review, and maybe we'll help you on your exams ahead. What I hope to do for you in this teaching is to help you be better able to interpret a fetal monitor tracing when you do have women in labor, and to categorize it. There's 3 levels, and then to identify interventions if you notice you had some problems on those fetal monitor tracings. First of all, I wanted to ask you though, has any of you been with a labor patient yet at all? No. Okay, you haven't been with a labor patient. I know you haven't seen any deliveries.
No.
Okay, all right. Interesting. Okay. Well, so this will be all brand new. I wish I had some patterns here. But on your second page, I do have these, okay? And why I wanted to go over this is that when you do an assessment on a patient, normally you have the patient in front of you, so you can see them, you can do an assessment. But what happens when you have a labor patient come in? You've got 2 patients, but one you can't see. And when I was a labor and delivery nurse, I always found that a little intimidating because, you know, you put that monitor on and you're hoping and praying that everything's okay with that baby when they come in. And really, that's one of the major ways you can assess how the baby's doing. There are other ways. It's not the only way. Sometimes you can do it through fetal movement, asking them how much fetal movement they've had, looking at risk factors that they've had during their pregnancy. All that kind of stuff is important. But getting that tracing is going to be a good way of really finding out how is that baby doing inside that mom when they come in labor. So that's one of the first things usually they do on admission to the labor and delivery unit. And have you all looked at some fetal monitor tracings at all?
Yes.
Okay. When you look at these 4 that I've shown you right here, what's the bottom area? What are these things here? What's that?
Contractions.
That's the contractions. And what's the top measuring?
Heart rate.
Okay.
Yeah, heart rate.
Now you've all seen the fetal monitor. You probably in your skills lab have seen it too. Okay. And this is just a refresher of what you're measuring here, the fetal heart, and then of course the toco up here is measuring your uterus. Now is this accurate, this system?
No, not as accurate as the intrauterine pressure catheter one.
Right, exactly. When you did your skills lab, did you all learn anything about that? The intrauterine one?
Mm-hmm.
Yeah.
Well, we didn't do a skills lab.
Oh, you didn't?
Yeah, we
Okay. I guess I assumed you did with the OB stuff.
But
Okay.
it was explained.
It was explained to you in class?
Yeah.
Okay, okay. Yeah, basically they actually put a little electrode clip right on the top of the baby's head. And so when the baby's born, sometimes you can see the little place where it was attached. And sometimes it's a little laceration. You have to watch to make sure it doesn't get infected. And the intrauterine catheter for the contractions is actually a tube that goes kind of underneath between the baby's head and the uterus. Like if you see this baby's head right here, it'd be going in right around here. So every time that contraction squeezes that baby, you'd feel the pressure of how much that baby's getting squeezed. So that's going to be your most accurate measurement. But still, the external system can do pretty good. And here's some examples. I know it says on the bottom what they are, so I can't ask you to tell me what they are. But why is this one reassuring? Before you even read underneath, when you look at that first one here,
Variability.
Because it goes back to the norm.
Yeah.
okay, the beat-to-beat variability,
And it shows that the nervous system of the baby is working.
yes, it does show good function of the nervous system. What else do you notice besides?
Within the
Normal range.
Right, okay, and what is your normal range for the heart rate?
120 to 160.
Yeah. Okay. And what else do you see? There's one other thing that tells you that this baby's probably doing good.
The baseline? Well, that's the same thing.
Okay, baseline,
The acceleration?
beat to beat, the acceleration. Yeah, you notice that acceleration there? That's a good sign. You do want to see that, okay? Now, if we go over this way, you actually see someone in labor on this side. You notice the contractions on the bottom. Now, what are you seeing on the top?
Deceleration.
Do you see any decelerations on the left upper?
Yes.
Okay. Actually, this is a tachycardic baby. The baseline is a little too high, okay? And really what you're seeing there for these little dips are not decelerations. Those are just beat-to-beat variability. But mostly what you're seeing is that the baby's heartbeat is too fast. What normally causes that to happen? The baby's heartbeat's too fast. Okay, hypoxia, yep, that's one thing.
Contractions too hard.
Okay, overstimulation of the uterus. What might be another thing? What happens to a person's heart rate when they're with their temperature, their body temperature?
Increases.
Okay, so if your mother had a fever, you might see tachycardia, right? Okay, that might be another thing you'd want to look for is infection. Okay. Now, if we go down to the bottom here on the right, what do you? I know it tells us what you see here. What do you notice about the early decelerations?
They mirror.
They go along with
Yeah, they mirror the contraction, exactly. But one thing that's reassuring about this strip is what? What's one thing that you see here?
Goes back to normal. It goes back to the baseline.
It goes back to the baseline.
Normal range heart rate.
Yep.
There's variability.
And there's variability. Yep. So that's a reassuring pattern. Now, this one on the bottom, though, what do you know about these decelerations?
score compression.
Okay.
And that's
Could be cord
insufficient
compression.
uterine pressure.
Oh, yes.
Yeah.
Yes.
Yeah, right.
Uteroplacental insufficiency. A+. That's great. Yeah. What do you notice about late decels? How are they different from the early decels?
They happen after the contraction. Yeah.
Okay, what you're going to notice is right at the top of your contraction, you see where the top part is? It starts dipping. That's your late decel. It doesn't mirror like the early decels. Okay? But one thing that is good about this strip is what?
The heart rate. The heart rate.
Okay, the
There's
heart rate
variability.
is good, and there's still variability. But you still would definitely want to keep an eye on this. And you wouldn't want to let a healthcare provider see this strip because of the late decelerations. Okay, let's go to the next page. Now there's a pathway, okay, that goes from the environment where your oxygen is all the way into the baby. Your baby obviously can't breathe. It's inside the mom. It's got to get oxygen, and I know you've learned in anatomy, you know, how the structure is with the baby and how the placenta works and everything. But you can see the pathway here. It starts with the lungs, which is actually maternal lungs. That's where your oxygen is going to go first, okay? And then you got to have a pumping heart. The mother has to have a good, strong heart, okay? That's really important. Vasculature would be her blood vessels. Can you think of some problems in pregnancy that affect, what's that?
Hypertension.
Hypertension affects the vessels. That's an important thing. Can you think of something else that might affect it during labor? Something that could bring down the blood pressure?
When they lose the
Bleeding?
fluids. Yeah. Lost fluids.
Okay. What about an epidural? One of the things they want you to look for is a drop in the blood pressure, the hypertension,